Well, I'm going to go ahead and get us started. It is 2 o'clock, so I'm going to read part of the script that I read last time. This is Janine Johnson, Chairperson for the Clarksville-Montgomery County Employee Insurance Trust. Today is April 27th, 2020. This meeting is being conducted under Governor Lee's Executive Order number 16, issued on March 20th, 2020. All voting will be by roll call with a yes or no by each trust member present. The Zoom video recording of this meeting will be posted on the CMCSS website by Wednesday, April 29th. At this time, I will establish a quorum. When I call your name, please indicate present. Marcia Demarest?
Present.
Mark Banaszak?
Present.
Amanda Beck?
Present.
Tommy Butler?
Present.
Charlie Hall?
Present.
Leslie Helmig? Donna Mahoney?
Present.
Tim Swaw? Jeff Taylor? Kimberly Yarbrough? Kelly Jackson?
Present.
John Smith?
Present.
Ed Long?
Present.
Michael Johnson?
Present.
Kay Rye?
Present.
Mary Thomas? Okay, we do have a quorum. I will go ahead and pull up the agenda. Okay, so again, this is an electronic meeting via Zoom, and it is being tape recorded. And the important thing is to remember that we do need to make sure that we do say our names before voting. And if you are making a motion, either way, make sure that you do say your name and you do answer with a yes or no. So the first item on the agenda is to review the April 1, 2020 minutes. I believe, Donna, you did send those out to everyone?
Yes.
Okay. Do we have any corrections, any comments, revisions?
This is Mark Banaszak. I move to accept.
Thank you. I have a first. Do I have a second?
Second.
And who is giving the second?
Leslie Helmig.
Okay, thank you. Do I have any conversation, questions regarding the minutes? If not, I'll go ahead and we'll do another roll call vote to accept the minutes as presented. Marcia Demarest?
Yes.
Mark Banaszak?
Yes.
Amanda Beck?
Yes.
Tommy Butler?
Yes.
Charlie Hall?
Yes.
Donna Mahoney? Donna, you may be muted.
Oh, yes.
Thank you. I'm assuming neither Tim nor Jeff have joined us.
They have not.
Kimberly Yarbrough? Kelly Jackson?
Yes.
John Smith?
Yes.
Ed Long?
Yes.
Michael Johnson?
Yes.
Kay Rye?
Yes.
And has Mary Thomas joined us? Okay, all right, the minutes are approved. Thank you. Next item on the agenda is on-site staff remarks. Charlotte, I believe you had something that you wanted to share to the screen.
Yes, I sure do. I'm gonna start the screen share now, and it's from our on-site hourly staff based off of last month's meeting. So I hope you enjoy it. It says that someone else needs to stop sharing their screen.
Okay, that would be me. There we go. I stopped my share.
Okay, great. Okay, all right. Can you see this?
Yes.
Yes.
and they just wanted to make sure to say thank you. So that was their presentation.
Oh, well, that was very nice. That was nice to be able to put all those faces to the different names we hear. So that was very kind of them. Thank you. And I know I received a separate email from, I think it was Tiffany who had sent a separate email. So that was really nice. So thank you. Okay. All right. Next item on the agenda is on-site clinic operations and compensation review. At our April 1st meeting, we did vote to provide additional $30 per hour, correct, Charlotte, for those that were classified employees, hourly employees that were working. And we did that in line with what was currently being offered to the nurses who are doing health screen. During that meeting, we did say that that would carry for 30 days, and we did want to revisit. So that is the main purpose for this meeting. So I do believe, Tommy, do you have some data that you were going to be able to share, or Charlotte, did you? I know one of you had that to share.
Sure. Yes, Charlotte's going to share it.
Okay.
Okay. We, from March the 30th until April the 24th, the hourly employees that were receiving the additional funds, the total for the 4-week period from the 30th until the 24th, the cost was $10,935.01. So of course it is significantly less than it would have been since we started downsizing staff, and we downsized significantly because of the low census. So we'll continue to downsize, and we're going to start to trend back up once the census starts to go back up. And then we'll continue to work towards infusion, like we had mentioned before, and also working to get the mental health person, if that is approved by the trust and by the board. So we are trying to make sure that we continually work on savings rather than additional costs to the trust. We wanted to say thank you, huge thank you, because of what that did for staff for last month. Not only were they appreciative, but it really did something for the morale, for them to feel appreciated. So we appreciate that. They understand it might end today, but we are grateful nonetheless for everything.
I'm sorry, I was had muted myself. Was there any documents, any data that you wanted to share, or was the next item the actual options moving forward?
The next item is going to be the actual options moving forward.
Okay. If you want to go ahead and share that.
Okay.
Yeah, I'll do this. Can everybody mute that? Can everybody mute? I'm still hearing feedback after that music was playing. I'm not sure. But anyway, so options are basically the same as they were last time. Just a reminder that the clinic staff, just like school system employees, are being paid whether they come into work or not. So that's kind of the starting point. So what we did last time was that pay plus $30 an hour if they did come into work, if they were needed to, just like a school nurse is getting now for screenings. One of the other options was that we would actually pay them time and a half to avoid them building up comp time. The third option was just normal pay. So in other words, whether or not they come into work, they get normal pay. And then the fourth and final option that we came up with anyway was like what other school system classified are getting, which is time. If time, they're getting paid their regular time, but if they do come in, they get comp time at half that rate, which poses the problem of them accruing comp time for the future when we're actually going to need them working. So those were the four options.
I mean, did you have that to share, that document that you can share?
No, Charlotte, can you share it? Charlotte, can you share that from your email?
Charlotte, you're muted.
Oh, Charlotte's muted.
I'm so sorry. I'm going to get in the document right now. Somehow I took myself out. I'm sorry.
Okay. Okay, I hope that works. Can you see the trust meeting information? Yes. Okay. At this time, I think it would be best if the members take a few seconds and look through those options, because this is something that we can definitely ask Charlotte and Tommy what their opinion would be if they want to provide us time if he wants to provide a recommendation. I know last time he did. But if you all want to take a few minutes and read through that.
Janine, I had a couple questions when you get a minute.
Yes. Uh-huh.
To Charla, I guess, can you provide any statistics as to how many people they're assisting with COVID symptoms?
Right now, it's hard to say because we've tried our best to limit them with the COVID symptoms. Once they tell us that they may have something that sounds like that, we are trying to get them to seek treatment elsewhere, of course. We've also reverted to telehealth to try to make sure that they're not coming into the clinic as much as possible. But of course, some are, escaping in. It happens, and other places are dealing with that as well, because not everyone's honest, but that's neither here nor there. So we're trying our best to limit that to keep them out of the clinic right now. But it's hard for me to give you actual numbers because it could vary day to day. I really don't know. And we want to try to do that as much as we can too in the future, because if they do have the symptoms, then we're having to completely cover head to toe as we were at the beginning and trying to screen them outside as much as possible.
So are you seeing just a larger volume of patients with this going on, or you're actually, you're seeing less and you're trying to eliminate the COVID patients to the
Correct.
primaries?
Correct. So we're doing the same as other places throughout town. We have a weekly call with the hospital directors and clinic directors, and everyone right now is looking at about half of their numbers, and our numbers are about the same, half or a little bit lower than that. So we're not seeing nearly as many people. We expect it to rise, of course, as the limitations are lifted, but right now we're on par with other clinics in town. As well, too, there's only certain clinics that are trying to offer the testing. I think everyone is feeling the same. You want to try to keep those people out as much as possible because of the PPE required. So we're on par with that as well.
And the staff that we're paying the $30 extra an hour, and that is just admin staff, or are they nurses as well? Just admin staff?
No, it's nurses and the admin staff. The hourly folks are the people that are answering the telephones that we bring in every day, and all the nurses. The providers and myself, we're all salary, so we're not receiving anything extra to be there.
Yeah, I just wanted to explain. I know I voted against it last time mainly because we aren't paying anyone else, EMS admin staff or the paramedics are not getting anything extra. The state health department's not getting anything extra. So it was kind of not that I didn't think anybody deserved it, but I felt like if some were not getting it, we needed to have more information as to why your office was. So again, not that I don't agree with it. We had issues with some of ours not being paid for it on the county side. And there are paramedics that are going out, taking these patients, doing in personal contact with.
Right. I think what one of the things that threw a little bit of a bind in that made it different than others is because the school nurses, they're getting paid extra money for the school system to take temperatures and to ask a questionnaire. And so I think when that came into play, that made it a little bit more of questions of, well, our staff is doing much more than that. And would that line up? I have told our staff members that for myself, and I think that they agree, they are completely grateful for what happened last month. However, they're getting paid to come to work and even to work from home. So being grateful for that, they know that my support was going to be, you're getting paid anyways to come to work. We're going to be grateful. And that's all we're asking is just to be paid as normal. Whatever is above and beyond that, if ever approved, is wonderful. If not, we are still excited that they're getting paid to work during this time period. So I definitely don't want to come off as being anything rather than grateful, because that doesn't line up with what the school nurses get. That's neither here nor there when it comes to our staff. We're grateful. So thank you.
Yeah. And Kelly, just to follow up on that, I mean, this group, the insurance trust, or really anybody on this call, didn't have anything to do with that decision about school nurses doing temp checks. So just wanted to make sure I made that clear.
Sure, and I think that's, we started the COVID-19 strategic plan saying this is not going to be fair across the board no matter what we do. So that's kind of where we had issues on the county side. I think we knew that our people were not getting it. And like I said, some of those were paramedics and people on the front line that weren't getting an extra stipend. So I just wanted to explain to that. I didn't want anybody to think we didn't think on-site was doing a great job, and we're always very grateful for you and your services.
Definitely. We understand that completely.
Question for you, Charla.
Mm-hmm.
A question for you, Charla. How many on-site employees have been getting that additional $30 per hour during the past month?
I think it's 8 or possibly 9. Those are all the hourly that are full-time that are working during this time.
Charlotte, can you clarify, the majority of them are not always working the 40 hours per week, though? Is that correct? You have them on a reduced schedule?
Yes, very much reduced. So what we're doing is we are having essential employees come to the clinic. There will be 2 providers at the clinic each day at the main clinic. And then we have a person that's answering the phone, and then a person that's a nurse that's doing the screening and or lab work. And on Tuesdays, we have a lab nurse. So basically, I think some week only work 1 shift. Others work 2 shifts during the week. But we really try to limit it because we didn't want to take advantage of the extra funds. We're not using that to take advantage of any of our insurance trusts.
And I just think, as a reminder, none of our providers, none of our nurse practitioners, physician assistants, or Charlotte herself received this extra. It was for the hourly employees in an effort to be equitable to what the school system was doing for the nurses, the school nurses. So, does anybody else have any questions?
So Charla, this is Marcia. So are we saying from what you said, it sounds like three employees per day at 8 hours and 5 days a week?
Probably 2, more like 2 employees a day, 5 days a week. The only difference is on Tuesdays, we're having a lab nurse there because we have pushed all the lab visits to that day as much as possible. So on that day, there's 3 people. And then what we've done is, as if it looks low as a census, I'm sending them home and I'm making the providers function solely in the clinic. So we've really cut a lot of hours, really trying to make sure we stretch it as much as possible. So if there wasn't a need for a nurse to be there or a front office person to be answering the phones, we send them home.
Okay.
Charlotte, did you have that total cost so far to the trust?
Yes, it's $10,935.01, and extra that would have been paid since this entire time, and that took us up to Friday. So April the 12th.
Okay.
And I anticipate, to be honest, the same type of running of the show until these numbers go up. We're gonna still stay, limit, because we don't want to take advantage of anything. Literally hour per hour.
Janine,
Yes.
can I ask one more question of Charlotte?
Yes, of course.
Charlotte, do you have a comparison if we had been paying time and a half instead of the $30 above the hourly wage? Do you know what that comparison would be?
I don't, but
Kelly, it would have been a little bit less. So, because most of them don't make $20 an hour, so it would have just been a little bit less. I think a rough ballpark, instead of 10,000, it might have cost 7,000 or 8,000 to do time and a half instead.
Okay, so they average about $20 an hour?
they average under that an hour. Most of
Yeah,
them were.
that's why I said, yeah, if they were averaging $20 an hour, it would have been different. But yeah, they a little bit less than that.
Yeah.
Do any other members have any questions for Charla or Tommy? I'll ask Tommy, do you have a recommendation as we move forward after, I guess, effective May 1st?
I mean, I'm hearing the clinic say that they're glad that they got it, and they're glad to just get paid whether they come to work or not. So I mean, the only difference is just like the questions that Kelly were asking is that, you know, school nurses are getting something different. So yeah, I don't really have a recommendation. I would probably vote just like I would with school nurses that they're getting paid, and so I would go along those lines. So the opposite end of where I was the last time.
So, so your recommendation is to keep it the way it is, or to go back?
No, it would be to do like other employees, and they're getting paid whether they come into work or not. I think that's what
Okay.
I heard Charla recommend, so she can clarify that.
Yes,
So
I did.
you go back to ending the $30 per hour, and if and they all are paid for their regular scheduled hours.
That's correct.
Mm-hmm.
Yes, they knew that was going to be my vote of support, was thanking you all for just the regular pay.
Mm-hmm. Did I hear another question?
Yeah, I have a question.
And I'm sorry, who is it?
This is Donna.
Okay, yes, go ahead, Donna.
So, I mean, we can go ahead but they do need to be compensated if they come into work, because aren't the other classified staff getting time and a half or comp time to come into work, even with everybody home? So,
Yes.
I mean, if they do come into work, we would need to compensate them in some way, don't you think?
Well, what we're doing right now for all of our employees is obviously by law, we have to compensate. So if we have employees that are being required to come to work and it's very limited, then we are providing them their hourly rate if they're classified employees plus comp equal to the hours they're working. And that's our policy. We have a policy in place for what we call mission essential employees. So right now, anybody that comes actually has to go into work to do their job, but again, it's very limited. That's how they're being compensated. They're receiving their hourly rate of pay plus comp time equal to what they worked.
Okay, so I mean, I would think that the essential employees at the clinic would at least need that.
Okay.
But I think this is Amanda Beck, but I think that the problem that we were anticipating is if they acquire too much comp time, then it's going to run into scheduling problems in the future. So we were looking for another way to compensate them.
Well, we can't pay them time and a half. The one option is to actually pay them for time and a half. Is that correct? I mean, that's what I'm reading, right?
Yes, and I believe, Tommy, these were the options from last time, correct?
Yeah, they were, and so the time and a half is definitely an option that would cost less and not have that long-term impact of accruing comp time.
Madam Chairman, can I speak one more time, please?
Yes, go right ahead, Kelly.
I think from our side, and I don't know how your people are working. Can they work remotely, Charla?
Some can, and the ones that, what I'm saying, some can, we all can. I've got everybody working remotely, but when they do the in-house, like for instance, the medical office assistants who answer the phone, we don't have a way to do that remotely. So someone has to come in and do that. And then the nurse is screening every person that comes in the door. So regardless of who it is, so that nurse does have to be there, or someone does. And so that's why it's been so limited, because those are people that are just forced to, we got to have somebody to be in there to do it. And we're all jumping in. Yeah.
And the county's policy is there are times that they are not working from home. So they may have sporadically 10 calls for the whole day, but they had a lot of downtime as well. So we're paying them whether they're working or not. So we're not paying them additional when they rotate in and out. So we felt like on the county side, it evened out because they are getting paid for time that they're not actually working. So I still, and I'm sorry, but I still have to go by on the county side. That's way above and beyond what county workers are getting. I understand the school system is getting compensated for it, but we're paying some employees that we know are not working 8 hours a day. Sometimes, if they have internet connection issues, et cetera, they may not work at all that day, but we're still paying them for it. And then, so when they do come in, we felt like it balanced out.
Do I have any other questions from any other members? Any comments?
Mark Bannister.
Mark?
Charla, to piggyback on Kelly's question, if they're working from home, are they logging? Are they just working a 2-hour block, or are they clocking an 8-hour day? And like Kelly mentioned, they may be on the clock for half an hour and then not for a little bit. I mean, how are they getting paid? Literally hour for hour or a block time?
As far as I understand, it's the same as everyone else. I have them doing assignments, and we have a new log that we got released this week. And so they're having to keep up with that and send it in. We are having our staff work on all the items that are things that I feel like need to be caught up on. So telehealth, how to use it, our tennis systems for vaccinations for all of our employees or kids, of the school system. They're also working on videos on how to use our practice fusion system more regularly. And then I've got a series of videos that they have to report in. I've been keeping them pretty busy. And then the latest was a project that we hadn't finished yet on in processing of new employees. So we've actually almost finished that project, but I've been mandating that they work on all those items from home. So even staff that had trouble with working from home, they're getting hotspots because that work is essential. And so we felt like it was a time to catch up, not just to sit at home and do nothing.
Okay, this is Mark again. So is that employee, we'll say employee A, who's working from home, and they're doing those trainings, they're getting caught up on those things you just mentioned, they're only logging hours that they're doing official school system or official on-site work?
Yes.
Mark, I do want to clarify,
yeah.
if they're scheduled for 8 hours and they're working from home, they're getting paid for 8 hours.
Okay. I was trying to understand that based on Kelly's question, just to make sure that it was comparable and they weren't just being paid for 2 hours because they only did 2 hours of work.
No,
okay.
they're being paid for the regularly scheduled number of hours that they normally work.
Something I forgot to mention too is our front office people, because we already have so much that's available via internet. So one person's answering the phones and that's their job during the day, but there's a second person that's assigned of the 3 that we have each day, because all of our forms and things like that, they have to go into our system and move places. So they're placing things at the correct area, and they're still taking care of electronic messages that we're getting sometimes from pharmacies. So there's a person behind the scenes, that's their job from 8 to 5, as well as the person who's at the clinic from 8 to 5. The only person who's getting extra pay was the person who's physically inside the clinic from 8 to 5. And I hope that makes sense. So we're doing that a lot with all of our jobs, because we get internal messages about the patients that we have to handle on our own, whether at the clinic or at home.
I think, we've heard a lot of different options. I think, we've seen what the cost was. I think it is, I'm glad to know that the members are very appreciative and that they have an understanding that this may not continue, but they appreciate what they did receive. I do think as trust members, we all know we need to be mindful of how the money is spent, but that's just one of my comments. Do I have any other questions from any other members for Charla or Tommy? If not, I think we may be ready to make a motion. Would everyone like to make a motion as how we proceed? I'm not hearing a motion unless someone is speaking and they're muted.
This is Marcia. I think I would make a motion that we discontinue the $30 an hour, but that we continue with the practice of if someone is coming in, that they do earn the comp time for that period of time.
Okay, so what your motion, Marcia, is to be equal to all other classified employees at this time,
Correct.
exception of nurses.
Correct.
Okay. And on the topic of comp time, we've got a lot of departments right now working with employees that have considerable amounts of comp time, and they're making plans on how to deal with that. But I do believe, Charlotte, sounds like you're being very strategic with your staff. That's good. Okay, do I have a second?
I will second that.
Okay, Kelly has seconded that. Any other comments or questions? Yes, Mark?
This is Mark Banasak. Marcia, is your motion open-ended, or is it for a set amount of time?
I would say, I believe till the end of the school year, May 22nd would be the end date.
Thank you. That's a good clarification, Mark. That's what's currently set for other groups of employees, is through the end of the school year, May 22nd, which I think is a Friday. And I think that's probably the last day that they're feeding children also. Okay. So I'm going to make sure I have this motion correct. So basically, Marcia made a motion to end the $30 an hour and to allow on-site clinic staff, hourly classified employees, to receive comp time equal to the days worked. And that will go through, I believe it's May 22nd, or whenever the other employees start receiving that extra benefit. Is that correct, Marcia?
Yes.
Okay, and then Kelly, you second that? All right, so we'll go ahead. No other questions? Not seeing, hearing any questions. If not, I'll go ahead and do a roll call vote. Marcia Demarest?
Yes.
Mark Banasak?
Yes.
Amanda Beck?
Yes.
Tommy Butler?
Yes.
Charlie Hall?
Yes.
Leslie Helmig?
Yes.
Donna Mahoney?
Yes.
Neither Tim nor Jeff have joined us, have they?
No, ma'am.
Has Kimberly Yarborough joined us? Kelly Jackson?
Yes.
Don Smith?
Yes.
Ed Long?
Yes.
Michael Johnson?
Yes.
Kay Rye?
Yes.
And has Mary Thomas joined us? Okay, and I vote yes also. Okay, unanimous. All right. Going to go back to my agenda. Okay. Next item we have is item number 3, COVID-19 medical plan benefits. Chris, are you able to share the document that you have?
I can try to pull it, yeah. And you want me to try to share the screen?
I will stop sharing. And if you run into problems, I may have it. Hold on. I probably have it. Is that it?
Yes.
Okay, great. I'll let you go ahead and go over that.
Okay. Hey, it's good to see everybody. This is pretty neat. Try not to take a lot of time on this, but we'll go through it. Hopefully you had a chance to look at the document and kind of scan it and see what's been taking place. Of course, the medical plan has had some changes, some mandated, some one of them you'll have to make a decision on today, but you can see there on March 11th, there was an easing of prescription refills. So there wouldn't be any type of risk of people not having their medication. So that's taken place. Also on March 11th, there was a government mandate for COVID testing with no member cost share. Of course, there's going to be some additional expense there for the trust, and be very difficult to project, but the average cost for testing is between $50 and $100 based on Blue Cross's estimates. And also on March 19th, the plan opened up for virtual telehealth visits. You all probably remember there was a telemedicine option years ago, and we did away with it because of on-site. And this program's a little bit different in that you can talk to your current providers over the phone or FaceTime or whatever method that they have available to you. So it's not a program that the trust had to purchase. It's opened up to anybody. And the way that the plan pays is the doctor would bill Blue Cross, and Blue Cross would pay just as a normal office visit, which is pretty neat. Now that they're saying that that's opened up through April 30th, we would think that they will extend. We have not gotten an update at this point, but that's certainly a good provision. I think we all agree on that. Then here on April 9th.
Sorry, I think I'm sharing an email, am I? Sorry about that. Let's see, I pulled up an email and there we go. Sorry, Chris.
Oh, it's okay. Yeah, on April 9th, the plan opted out of COVID treatment with no member cost share. In other words, the plan would pay 100% for anything that was deemed COVID related.
And I'm just gonna, Chris, I'm just gonna step in here. We opted out because I didn't feel comfortable opting in without the trust discussing it. And this came out probably about a week after our last meeting. So I did at that time say we need to opt out until we discuss this at the trust on whether or not we want to opt in and cover 100% of any costs associated with COVID-19. So is that a good summary, Chris?
That's very accurate, yes.
Okay.
You can see Blue Cross came up with some ranges there. The low range about 40,000, mid range 103,000. The high range 208,000. They're really kind of shooting from the hip there. There's nothing to base that on other than some projections they've made. So it's really no telling what the cost would be, but that gives you some ideas there. I guess typically we feel it's always best if some skin in the game. Your plan pays a very, very high level of benefits. And so if somebody did have some type of condition based on COVID, then of course the plan would pay at this time based on your normal plan provisions with the deductible, co-insurance, and out-of-pocket max. But the trust will need to make a decision whether you want to opt in and change this provision to where treatment for any type of COVID related care would be paid at 100%.
Does everybody understand what's going on here? So basically, we have an option where we can say we're going to cover COVID at 100% for any of our members. And that means they don't have to worry about the deductible. They don't have to worry about co-insurance. So it would be treating this specific disease differently than we do any other disease. If we don't want to, if we want to continue to remain opted out, we don't have to make a motion because that's currently what's in place. But if anyone feels that we should be covering this at 100%, I would entertain a motion.
This is Mark Banasak. What is the state doing with their plan? Did they opt in or did they continue with what normal? Or do we know that?
They did opt in. It took them a while to make that decision, but they did opt in, so they're covering it differently than any other disease. Now, I don't think they have lower deductible and the lower or the lower out of pocket like we do. But they did make that option.
Hey, Chris, this is Tommy. Do you know if they're going off confirmed cases or is it assumed?
Oh, I do not know the answer to that question.
Hey, Chris, to follow up on that, just, where my mind goes, what's going to be the limit to COVID related? Is that going to be a medical provider saying it's COVID related, or what if somebody had an underlying condition and, maybe COVID contributed to it, but wasn't the total condition? So where's the line there?
I think that's the gray area that's unknown. And of course, like any other medical procedure, it depends how it's coded, is how the Blue Cross would pay. They're not going to try to interpret it, to just be based on the code that the provider uses to submit the claim.
I would make a recommendation that we don't have a motion on it and that we keep it the way it is.
This is Ed Long. Could we revisit this issue later if we needed to?
Chris, can you confirm that with Blue Cross, that if at a later date we wanted to opt in, that we could?
They had mentioned that you would have that option. It's a little bit longer to configure things, but they can reconfigure and actually retro the provision to the date that you wanted it provided.
So, as I mentioned before, since we've currently kept our plan design as it is in place for any other disease, I don't need a motion unless someone wants to make a motion indicating they want us to opt in and cover COVID-19 at 100%. I don't think I'm hearing a motion. Any other questions on this topic? Okay, so we will continue to monitor this, Chris, and that's something that we can continue to watch. I'm sure within another few months, they'll be able to let us know if we've had any members that have been treated, and we will be able to start looking at that data, correct?
That's correct. There, you're right there, the comment below the high range. You can see where Blue Cross will been able to configure some cost data. And so we'll know more probably just within the next week or two. We'll have a little bit of information. So we'll monitor that too.
So we'll add this to our agenda for our next meeting to continue to monitor. Okay. All right, so we'll move on. We'll pull up the agenda again.
Hey, Janine, this is Mark Banasak.
Yes.
Next item. Can I ask a clarifying question about we're paying the folks during the month of April?
Sure. I'm sorry, what was that?
I was reviewing the minutes as the discussion was happening about how we were paying the on-site people. And according to the minutes, it says that we were paying them an additional 30 hours, an additional $30 per hour for any hour worked. And I got a little confused during the discussion a few moments ago. Were they receiving a $30 flat rate, or were they truly getting their pay plus an additional $30 per hour?
They should have been getting their rate of pay plus $30 an hour if they were in the office working, not if they were working from home. Yes.
Okay, I was confused. Thank you.
Yep. Mm-hmm. Sure. Okay. Next item, on-site expansion update. Tommy?
Yeah, I'm off mute. So the clinic work with the architect is ongoing. We're over 95% complete towards a bid date of June the 2nd. I did talk to the architect today about, not that I want this to happen, but if this group decided for it to happen, that if we delayed that a few months, that we would still be ready to go whenever we pulled the trigger. Of course, costs could go up. But it is a possibility that we could delay the project because of the uncertainty. And I'd emailed Marcia earlier, I think this week, and asked if she wanted to provide any color to the status of the trust and if we were to delay that project. But all of the design work will not be wasted. We can go to bid whenever we're ready.
Right. So, I mean, as far as status of the trust, I mean, we'll go over the financial in a little while. And I mean, we're kind of on target to where we had been, but I kind of feel like with the uncertainty that we have at this point in time, and also just thinking about as far as the school system has been handling things and having, you know, we've kind of restricted having contractors coming in and doing work. So, you know, I think at this point in time, and until we kind of get past the uncertainty of what is going to happen, and of course, you know, we just talked about the COVID-19 claims and, you know, the cost of those. I guess my recommendation would be that we kind of hold for a little while until we kind of get past knowing, you know, where we're at and, you know, what's going to happen with the current conditions.
So,
This
Tommy,
is Mark Vanasat. Sorry, go ahead.
Yes. No, go ahead, Mark.
This is Mark. From a revenue standpoint, the trust is not losing any revenue because our members are still paying in every month. So from a revenue standpoint, we can still afford it. It's just based on the uncertainty of extra people coming into the clinic.
That, yes, that, and also, I mean, the uncertainty with, I guess, costs, you know, as we just looked at with the, you know, COVID-19, if we have, you know, members that are, I guess, you know, were to get, I guess, you know, contract, you know, the disease and the additional cost that would be as far as treatment. So potential cost increases related to the COVID-19.
Okay, thank you.
So, Tommy, for clarification, what we could possibly do is delay putting the bid out. We could, all of the work that the architect has done, but we could say instead of putting the bid out next month, we revisit this and look at where we are in August. Is that basically what you're saying?
Yeah, that's exactly right. So we'll be ready to go from an architect and engineer perspective whenever the trust is ready to go if we decide to delay it. It won't cost us anything additional to wait a little bit.
Mm-hmm. Do I have any other questions or comments from the group? I know we definitely want to do this expansion, but I do think there is something to be said about being cautious during this time. We all know how tight the budgets will be. I know some of this was going to be offset by the Blue Cross Blue Shield wellness credit, but there will be some that will also be paid by the trust through our reserves and our balance.
And just one other positive, if we did delay it a little bit, when the veterans group does move out, which I think Charlotte can correct me, I hear that's happening in June, that if we were to have to delay longer, we can still go ahead and start using that space. It just won't be remodeled and connected well, but we can use the space.
Okay, thank you, Tommy. And I appreciate you bringing this up, because I do think it is worth us thinking about, because we know things are going to be very different in the next few months, and everyone's having to really look at their budgets and tighten as much as possible. I don't know that we necessarily need a motion on this issue. I think we can, I mean, we're not saying we don't want to do it, but we're simply saying that it may be wise to delay the bid. Carol, do you feel that I need to have a motion on that to delay?
I mean, I don't remember exactly how it was voted on the last time. I think it was just an approval to go forward.
Right.
So if you know, with this discussion, if you and Tommy decide, you know, we're just going to delay the bidding process, that's really not going against the prior decision, in my opinion.
Okay, thank you. Do any other members have anything they'd like to add to this conversation? This. Okay. So if not, I think that's something then that we definitely can look at doing is look at delaying. And Tommy and Marcia and I can get together and talk about, you know, an appropriate time that maybe we want to open that bid back up. Okay. Any other questions? Okay. Next item is, let's see, premium increase information, communications history. I believe, Donna, you've sent that out. I do have, let's see, I'm going to go ahead and pull up just as a reminder. Wanted to pull up the, maybe I don't have it, the premium history. Thought maybe I had pulled that up, but I don't. We do have the premium history that was sent to everyone and a sample of the letters that will be sent out to all the employees, very similar to what we have done in the past, showing them what their new rate will be, reminding them of the different areas that they can do to save money for the insurance trust. So we'll be sending, Donna, what is the plan to send those out? Is that sometime early May?
Yes, around May 8th, they will go out by email to classify, well, bi-weekly paid and monthly paid employees.
Okay, great. And that's what that communication has, all of the different rates based on if you're paid monthly, bi-weekly, and when you were hired, because the contribution rate is different based on that, and for classified employees, how many hours you work a day. So that was sent out to you. Next item is financial statement review. I know those were sent out. Marcia, would you like to go over that? Do you want me to try to pull that up?
Yeah, if you want, or if everybody has it, I'm just going to be going over numbers and big picture. So we did send out the February and March financials. So I'll just kind of talk about the February. It is in balance. The fund balance was $16,910,651.85. That was medical revenue of $4,651,272.20 and medical expenses of $5,463,973.87. That did result in a decrease in our fund balance of $812,701.67. The balance as of March is kind of in line with what I had projected when I did the roll forward that we talked about when we did the 5%, or when we looked at the increase for the plan. The fund balance represents 3.08 months of reserve based on the average cost, which is down slightly from a year ago when we had 3.6 months in reserve.
Okay. Anyone have any questions regarding the financial statement? Again, those were sent to you via email. No questions. I will entertain a motion. And this is approving February and March, correct, Marcia?
Yes.
Okay.
Make a motion to approve. This is Kelly Jackson.
Okay. Do I have a second?
Amanda Beck, second.
Okay, thank you. Any other questions? If not, we'll go ahead and I'll do a roll call. Marcia Demarest?
Yes.
Ganisak?
Yes.
Amanda Beck?
Yes.
Tommy Butler?
Yes.
Charlie Hall?
Yes.
Leslie Helmig?
Yes.
Donna Mahoney?
Yes.
Kelly Jackson?
Yes.
John Smith?
Yes.
Ed Long?
Yes.
Michael Johnson?
Yes.
Kay Rye?
Yes.
Okay, thank you. We have approved. Right. Next item on the agenda is next meeting is scheduled for May 12th, and we have a question mark there. I think we probably need to keep that as a question mark. I would assume that we will continue to do Zoom meeting for the next one. I don't know that we need a May 12th meeting. Anyone have any questions on that?
Yeah, the only thing was the motion for the on-site pay would have to come up before then if we look at that again. I guess it depends on what the board does with other employees.
Right. Right now, the way our motion was that it would go through the May 22nd. So if for some reason the board continues beyond May 22nd, then we would need to meet again. So we'll, unless anybody has any other concerns, we could look at trying to schedule for June. Does that sound good for a June? And we can assume do it Zoom, and then if we're able to have it in person, we could have it in person.
Janine, right now, the governor's executive order only goes through May 18th for electronic meetings for public bodies. That obviously could change. So I think you schedule it, but knowing that it may be in person, it may be on Zoom, depending on what the governor's executive order, whether it's extended or not.
Okay, thank you, Carol. So it goes through May 18th. So let's look at June. This will be normally in the summer months, so we do schedule these more during the day. Does anybody have, is there a certain day of the week that works better if we were looking at the week of June 8th?
This is John Smith.
Yes.
I would prefer staying away from Monday.
Okay. How about June 9th, which is a Tuesday?
That's good for me.
Would we like to do like a mid-morning 10 o'clock for June 9th? I don't think I'm hearing any concerns on that date. So we'll shoot for June 9th, 10 o'clock. We'll assume it will be an in-person meeting. If it is not, and the executive order has been extended, then we'll do another Zoom. But we'll do June 9th, 10 o'clock then.
Could I jump in even though I'm not on the trust?
Yes.
At 10 o'clock right now, those are the dates that Tommy and I are doing the meetings with the hospital directors and clinic directors if the pandemic is still going on.
Okay.
And that's on Tuesday.
How about 1 o'clock? I'm seeing thumbs up. Okay, let's shoot for June 9th at 1 o'clock. And we'll hope that that works for everybody. Okay? All right, well, it was great seeing everybody. And I appreciate your time. And I think there's still some sunshine left out there. So hopefully you can go out and enjoy that. All right, thank you so much. Have a great day. Bye-bye.